3 reasons why you should start to work with autogenous bone. In this video, you will understand why it's so important to avoid artificial or substitutes materials for bone augmentation. See you in the video. Bye. Welcome back to this video, and I'm going to share with you my experience with colleagues about the last years, which excuses they have to avoid to start with autogenous bone. On the first place, on the top, is the explanation of our colleagues that the patient didn't want, or they don't want to have a bone harvesting from the intraoral site. This is the main excuses what I'm hearing always. And then I couldn't understand why it's so, because in our world, an autogenous world, and in the patient communication or patient acceptance communication, we heard this very less, because the goal is not to harvest the block from the retrum wall. The goal is a long-term result. And the shift, the mind shift of our colleagues to much more focus on the harvesting part of the surgery and maybe the risk is the most of the reason that the colleagues in the consultation with the patient, the first consultation, they are speaking too much and too intensive about the complication in the first consultation. This was my experience, what I collect over the years in the training and coaching of our implantologists. They want to become an expert in reconstructive implant surgery. They are speaking too much in the first consultation about complications. And then, one very interesting example to this. One of our participants, a very talented oral surgeon, normally he's doing different tumor operation, different big operation, but he was not confident with bone harvesting technique from the linea obliqua externa. So he joined our training, and then he explained me that he had 5 consultations with patients about bone harvesting, bone augmentation, horizontal or vertical case, and he told me every 5 patients they didn't want to let him to harvest bone from the retromolar area. I asked him, what are you speaking with the patient in the first consultation? Yes, I am an ethical doctor. I am so in my consultation that I explain everything in the first consultation. What you are doing? In the first consultation, you're speaking about what? Give me sentence per sentence what you are saying. After he explained me what he told the patients, the summary was that he tried to give all the risk of a bone harvesting. And I'm asking him, why you are doing? Maybe I understand, because I think you are not so confident with the method that you try to bring the patient to the position that the patient should say no to the treatment. It's correct, my friend? Yes or no? And the answer was yes. He wanted that the patient say no to the treatment because he was not ready with the protocol. He was not ready with the surgical skills, and this is, my friends, not ethical. Of course, you should know your limits, your borders, of course, but in the communication skills, you have to also increase, like your surgical skills for the treatments. Both is very important. If you think you can do something very good and your communication skills is very less, My friend, this is a worst scenario what you can get. Nobody knows your skills. You have to communicate your skills. This is what I can share with you. So, and we change his communication in the consultation, how he should say the treatment plan, how he should deliver his opinion and his steps. And after this training and coaching from the communication skills, after this time, the patient acceptance rate to the bone harvesting, to the treatments for reconstructive surgery increased very high. So this was the first reason. The second reason why colleagues, they don't want to start with autogenous bone technique is in the mindset, because the mindset is a big problem. Because over the years you got information that biomaterials is the gold standard, better as bone, is not resorbing, you can graft everything. But my friends, ask your colleagues. Don't believe some articles, don't believe some advertising of materials. Ask your friends, ask your colleagues. And what I learned from our participants are, they are frustrated with biomaterials. They have not predictability, they have long healing time, and smoker, risk patient, diabetic patient, complication cases, this is not the indication. Also, you have some indication for biomaterials. It's a defect, is related to the defect, but in out of the contour defects or vertical augmentation is a clear recommendation for autogenous bone. But this is not what the colleagues around the world are using. So my second reason is the mindset. You have to shift your mindset, and you have to trust autogenous bone, and then you have to increase your skills. Okay, because the first problem you will get if you start with this technique, and you will get your first difficult case, and if your mindset is not ready, you will lose the trust in autogenous bone. You will go to the easiest way, because your brain will protect your you. Is the job to protect you against uncomfortable situation, and for you is the uncomfortable situation to make a donor site open for bone harvesting, to split the block, to make the reconstruction. All this won't avoid your brain against, because the brain want to use the same comfortable way of working and easy way. So, but not always easy means successful. So, and sometimes minimal invasive is not enough. So the reason second is change your mindset, delete your hard disk, and start to trust autogenous bone, and your life will change forever. Third one is practice, and try to produce own cases with autogenous bone or autogenous tissue. How you can do? You can start with small cases, with soft tissue augmentation cases, pedicle palatal flap. If you try to close a socket, you can use this. Start with practice. Get more cases to do it, and with this practice, you should be in an environment with colleagues where there are like-minded like you, have the same goal to start with autogenous bone and to implement a predictable, fast and safe technique to be able to reconstruct horizontal and vertical cases for your implant patient and to become an expert. So my friend, I hope the three reasons. First reason, I will make a summary, is first is the excuses that the patient's decision against the bone harvesting is one reason. The second is your mindset. You have to be ready to start. You have to be trust in autogenous bone. And third, is practice the technique very often and in maybe small cases, and then progress in bigger case. And your friends, colleagues around you should be not the colleagues of biomaterials, because they will destroy your path, your journey, and try to be in our environment with colleagues they have the same goal to become expert in implantology for hard and soft tissue reconstruction. So if you want to learn more about this, under this below the video you will find a link. You can send us a request for this. You should go to our website, you should fill the form, then we will speak together, contact you and speak about your current situation. What are the challenge what you have at the moment, how we can help you. Maybe we cannot help you, we will select the colleagues who is able to go the journey with us to become expert. So we are not on the position that we have to help everybody. We help only the colleagues that are ready to start to become an expert. So again, go to our website, fill the form, and let's speak about your future. And my claim is trust autogenous bone.